Bismillahirrahmanirrahim. Assalamu alaikum students. Let's start today's lecture. Today we are going to study the infratemporal fossa. What is the infratemporal fossa? Basically, we have studied the temporal fossa. So above the zygomatic arch, this is the zygomatic arch, and above the zygomatic arch is the temporal fossa, and below the zygomatic arch is the infratemporal fossa. So we discuss its definition properly. Irregularly shaped space deep and inferior to the zygomatic arch. So it is the space which is below the zygomatic arch, and it is irregular in shape, and it is deep to the ramus of the mandible. You know that in front of the zygomatic arch, in front of the here, you know that there is the ramus of the mandible. So below the ramus of the mandible it is located, and the temporal fossa is above and infratemporal fossa is below, and both are communicating through this zygomatic arch. Okay, what are the boundaries of the infratemporal fossa? So if we discuss about the anterior boundary, so anteriorly there is the posterior wall of the maxilla. You know that here is the maxilla bone. This is the zygomatic arch, and in front of the zygomatic arch there is the maxilla bone. So the infratemporal fossa's anterior boundary is forming the maxilla, and the roof is forming basically the greater wing of the sphenoid bone. And what about the medially? Here is the pteryg. Here this is the medial wall, this would be the medial wall, and medial wall is formed by the lateral pterygoid plate, and palatine bone is also forming the medial boundary of it. And what about the lateral boundary? Laterally is the ramus of the mandible. Okay, so let's discuss about the contents of this infratemporal fossa. So the two muscles are included in it. One is the medial pterygoid and one is the lateral pterygoid. So two muscles are included. The one is medial pterygoid muscle and the other one is the lateral pterygoid muscle. So the nerves involved are the mandibular and the maxillary nerve. This picture is of contents which are clearly showing you that the maxillary nerve and the mandibular nerve both are the contents of this fossa. And the chorda tympanic, which is basically branch of the seventh nerve, and first and second part of the maxillary artery and its branches are also included in it. So what are the first and second part of the maxillary artery? We will discuss it after some time. So posterior superior alveolar artery is also included in it. Posterior superior alveolar artery is basically a branch of the maxillary artery. We will discuss it. And all the arteries have some veins along with them, so these veins are also included in the contents of the infratemporal fossa. Okay, so here is an assignment for you. You have to draw and write the contents of infratemporal fossa. Okay, so let's discuss the contents of the infratemporal fossa in detail. So we have the two muscles. One is the lateral pterygoid muscle and other is the medial pterygoid muscle. Both of these muscles are arising from the lateral pterygoid plate. So here is the lateral pterygoid plate. I will point out. So from the lateral pterygoid plate, both muscles are originating. The lateral pterygoid muscle is originating from the lateral side of the lateral pterygoid plate, and the medial pterygoid is coming from the medial side of the lateral pterygoid plate. So both of these muscles have the two heads. Or if we discuss the first, we discuss the lateral pterygoid muscle and the two heads of the lateral pterygoid muscle. One is the upper head. Upper head is basically coming from the infratemporal surface of the greater wing of sphenoid. You know that here is sphenoid, so this is the infratemporal surface of the greater wing of sphenoid. So this is the upper hand which is coming. So and the lower end is coming from the lateral surface of the lateral pterygoid plate, and both of them are inserted into the pterygoid fossa and the TM joint, temporomandibular joint, and the capsule of the temporomandibular joint. Okay, let's come to the medial pterygoid. The medial pterygoid is coming from, have also two heads. One is the deep head and one is the superficial head. If we discuss about the deep head is coming from the medial surface of the lateral pterygoid plate. And what about the superficial head, which is basically coming from the tuberosity? This is the superficial head. This is the superficial head, and this one is the deep head. Deep head is coming deeply, and superficial head is somewhat superficial. So it is coming from the tuberosity of the maxilla. And what about the insertion? Insertion is on the mandible. So lateral pterygoid and medial pterygoid, two muscles are included in the infratemporal region or the infratemporal fossa. The lateral pterygoid is coming from the lateral side of the lateral pterygoid plate, and medial pterygoid is coming from the medial side of the lateral pterygoid plate. Lateral has two heads, one is the upper and one is the lower, and medial has also two heads, one is the deep head and one is the superficial head. Superficial and deep both are inserted into the ramus of the mandible. And what about the nerve supply? Both of these muscles are supplied by the nerve, which is the lateral pterygoid nerve and the medial pterygoid nerve. And if we talk about the action of both of these muscles can be cleared from their insertion. As you know that this is the TM joint, temporomandibular joint, and here lateral pterygoid is inserting and the medial pterygoid is also inserting on the mandible. So what will be the action? Both of these muscles are involved in the side to side movement of the mandible. When they contract, side to side movement of the mandible take place, because their insertion origin and insertion can show you. Okay, so this is another picture of the medial pterygoid muscle, and it's showing the superficial head and the deep head of medial pterygoid muscle. Okay, so here is another assignment for you, that you have to draw a table which is showing you the origin and insertion, nerve supply and action of the medial and lateral pterygoid muscles. So let's come to the other content of the infratemporal fossa, which is the maxillary artery. What is the maxillary artery? Maxillary artery is basically a branch of the external carotid artery. This is the external carotid artery. So from the external carotid artery, two terminal branches are coming. One is the superficial temporal, which we are not going to discuss, and the other is the maxillary artery, which we are going to discuss. Maxillary artery is just appearing from this external carotid artery in front of the ramus of the mandible. This is the ramus of the mandible. You can see it's going behind, and then here at the angle of the mandible it is coming to the face and supplying all this area. We will discuss its branches in detail, but let me tell you that the maxillary artery has a very wide distribution on the face. So we will discuss the maxillary artery in three parts. One is the first part, and then we have the second part, and then we have the third part. This is the point from where the maxillary artery is appearing from the external carotid artery. So first it go forward and upward, and then it goes all the time it is going upward, but the pathway is going to be some change in three branches, in three, or you can say parts of the maxillary artery. So let's discuss one by one in detail, and first we will study the supply area of the maxillary artery. That the maxillary artery is supplying some dura mater, okay, some dura mater, and it is supplying here to the auditory canal and external and internal ear, and then it is supplying the upper jaw and the lower jaw and the teeth too, and here it also supplies the nose and the paranasal sinuses, and here it supplies the palate, and here lies the root of the pharynx. So the root of the pharynx is also supplied by the maxillary branches of the maxillary artery. So let's discuss the parts of the maxillary artery one by one. First we will discuss the first part. This is the first part of the maxillary artery. The maxillary artery's first part is somewhat horizontal and it runs obviously forward, okay, somewhat horizontal and forward. And the important thing that is about the first part of the maxillary artery is that it lies between the mandible and the sphenomandibular ligament, okay. So here this is the first part of the maxillary artery, and it lies along the lower border of the lateral pterygoid. Here let me tell you one thing, that all of these parts, I mean first part, second part and third part of the maxillary artery, are just very much related to the lateral pterygoid muscle, as the first part lies just lower to the lateral pterygoid muscle, and the second part lies just superficial to the lateral pterygoid muscle, and the third part lies between the two heads of the lateral pterygoid muscle, which we discussed earlier. So let me tell you once again that the three parts of the maxillary artery are very much related to the lateral pterygoid muscle, as the first part of the maxillary artery runs forward and horizontal, and it lies on the lower border of the lateral pterygoid muscle, and the second part lies just superficial, and third part lies between the two heads of the lateral pterygoid muscle, okay. So this is the second part of the pterygoid muscle, the second part is also called the pterygoid part, because I told you that it runs just superficial to the pterygoid muscle, lateral pterygoid muscle, and that's why it is also called the pterygoid part of maxillary artery. Okay. So what as the third part? The third part of the maxillary artery is the pterygopalatine part, and I have already told you that it is at the part of the maxillary artery which lies between the two heads of the lateral pterygoid muscle, and it enters the here it is entering the pterygoid fossa. Okay, let's discuss about the branches of the pterygoid. So let's discuss about the branches of the each part of the maxillary artery. So first we will discuss the branches of the first part. So this picture is showing you the first part, second part and third part. So the first part is giving branches which are the deep auricular. First branch is the deep auricular branch. Deep auricular branch is the branch which is supplying this area, which is the area of the external auditory meatus, and the tympanic membrane, and the TM joint is also here. So the first part is supplying this region. Okay. The anterior tympanic branch of maxillary, first part of the maxillary artery It is supplying the middle ear and the medial surface of the tympanic membrane. And then we come to the most important branch of the middle meningeal artery, which is middle meningeal artery. And basically middle meningeal artery is coming from the first part of the maxillary artery. So this picture is showing you the distribution of the middle meningeal artery. So the middle meningeal artery lies between the lateral pterygoid and the sphenomandibular ligament. Here it lies on the lateral pterygoid and the sphenomandibular ligament. Basically, it enters the skull through a foramen which is located in the middle cranial fossa, and the name of the foramen is the foramen spinosum. I guess you people have studied foramen spinosum in the when we discussed the norma basilis. So when enters into the skull, it divides into two branches. One is anterior and one is the posterior anterior branch and the posterior branch. And the branch which is anterior is larger and the posterior one is smaller. Posterior branch or small branch is also called the parietal branch, and the anterior branch which is larger is also called the pterion branch. Okay, so let's discuss about another branch of the first part of the maxillary artery, and this is the accessory meningeal artery. Accessory meningeal artery is entering the skull through a foramen which is called the foramen ovale, and it is basically going to supply the meninges. Okay, and it also supplies some structure which is present in the temporal fossa. So let's discuss about the inferior alveolar artery. It is also a branch of the maxillary, first part of the maxillary artery. So this picture is clearly showing you that here you have the inferior alveolar artery, and here it enters the mandible through a foramen, and it runs through the foramen. From foramen it runs to the mandibular canal, and is going to supply this whole part, the teeth, and the lingular branch is also supplying the tongue, and this omohyoid branch is supplying the omohyoid muscle. And this mental branch, but here is the mental foramen, and from the mental foramen mental branch is coming, and which is supplying this portion which is the portion of the chin. So these are the branches of so we discuss all the branches coming from the first part. So this is the picture which is showing you that this is the external carotid artery, and from here the maxillary artery is coming, and the maxillary artery is first part, second part, and then the third part. We discuss all the branches which are located in the first part. So there were 5, 1, 2, 3, 4 and 5. 5 branches are in the first part of the maxillary artery, and then the second part comes. From the second part 3 branches are coming. Okay, you will say that these are not 3, these are 4. Basically these are 3, but these two are considered as one branch. Okay, so 1, 2 and 3. So these 3 are coming from the second part, and 6 branches are coming from the third part. So total 15 branches are coming from the maxillary artery, 5 from first and 3 from second, and basically 6 from the third part. And what are the branches coming from the second part? Basically the second part which we discussed, and second part lies on the superficial to the lateral pterygoid muscle. This part of the maxillary artery is supplying only the muscles. All you can see here, I have wrote for you that only the muscular branches are coming from this portion. the masseter branch for the masseteric muscle, and the deep temporal artery. And deep temporal artery is basically dividing into anterior and posterior division, which I shown you in the last picture. And then the pterygoid muscles. From the pterygoid muscle, I means that the pterygoid, lateral pterygoid and the medial pterygoid, both of these are supplied by the branches which are coming from the second part. And then the buccal branch. Basically the buccal branch is a branch which is supplying this area, which is the chin area. So cheeks area, the area of the cheeks is supplied by the branches which are coming from the second part of maxillary artery. Okay, so these are the branches from the second part. Only the muscular branches are coming. Then the branches which are coming from the third part, basically the 6 branches are present which are coming from the third part of the maxillary artery. The first one is the posterior superior alveolar artery. So the posterior superior, I have shown you over here that the posterior superior is coming and it is applying all this region, and it is basically coming from this, it is moving in the fissure which is the pterygomaxillary fissure, and here it descends in the alveolar canal, and it is supplying all the maxillary air sinuses. Then we have the infraorbital artery. Infraorbital artery, this artery is basically coming from here and then here and then here, and it is supplying all this region. It is basically entering the orbit through this foramen, this fissure. You know that this fissure is the inferior orbital fissure. In the inferior orbital fissure, maxillary arteries branch is coming, which is the infraorbital branch, and this branch is coming and supplying all the area of the orbit, like the orbital muscles, which are the orbital muscles, and the lacrimal sac. You know, here is the lacrimal sac, and the maxillary sinuses. Here are the maxillary sinuses, and the canine teeth. All this area is supplied by the infraorbital artery. So another branch of the third part is the greater palatine artery. So this is the area of the distribution of the greater palatine artery. So let me tell you that we studied when we were studying about norma basalis, we discussed a foramen over here, which is the greater palatine foramen. From the greater palatine foramen, an artery is emerging. This artery is basically called the greater palatine artery. It is moving on lateral side and it is moving to the incisor foramen. Here you know that in the center the incisor fossa or the incisor foramen is present. So it is supplying the all this area, which is the area of the soft palate and the tonsils, and moreover it is also supplying the palatine gland and the mucosa of the upper gums. Let me tell you one other thing, that here where I am pointing out, here another foramen is present, which is called the lesser lesser palatine fossa. So the artery which is coming from the lesser palatine is also a branch of the greater palatine artery. So the pharyngeal artery is also coming from the third part of the maxillary artery, and it runs backward and through a canal which is present in the sphenoid, and it is supplying the nasopharyngeal auditory tube and all the sphenoid air sinuses. Okay, So another branch of the pterygoid artery. Pterygoid artery third part is maxillary artery's third part is giving the pterygoid artery, and the pterygoid artery is going backward. When it comes out, it goes backward, and it supplies the pharynx, auditory tube, and the tympanic cavity. So this is the last branch of the third part of the maxillary artery, which is the sphenopalatine artery. This artery is also called the artery of the epistaxis. You know that what is epistaxis? Epistaxis is basically the bleeding from the nose. So the artery responsible for the bleeding from the nose is the sphenopalatine artery. So this is an important MCQ question for you, or Viva question. Someone can ask that what is the artery of the epistaxis. So sphenopalatine artery, which is a branch of the third part of the maxillary artery. Why it is the artery of the epistaxis? Because this artery is supplying the lateral wall of the nose, the medial part, which is the nasal septum of the nose. So this artery is responsible for supplying the nose, the lateral walls, and the nasal septum. And this artery is coming or entering the nose, the cavity of the nose, through the sphenopalatine foramen. Sphenopalatine foramen is nothing but a cavity or in the lateral wall of the nose through which the sphenopalatine artery enters the cavity of the nose. So once again I'm telling you that sphenopalatine artery is the artery of epistaxis, and it is responsible for bleeding from the nose. Okay.